Welcome to Healthy Hearts. We're glad you could join us tonight. My name is Megan, and I will be the moderator for tonight's event. During the presentation, we encourage your participation. So please use the Q&A button at the bottom of your screen to submit any questions you might have, and we'll be happy to answer those for you at the end of the presentation. This presentation is being recorded and will be available to view afterwards on the Iredell Health System YouTube channel in the coming days. I'd like to now introduce you to our speaker. Tori Hudgins graduated from UNC Greensboro with a Bachelor of Science in Biochemistry in 2003 and moved to Statesville in 2005. She graduated from Wake Forest University's Physician Assistant Program in 2012 with a Master's in Medical Science. Tori worked in oncology hematology for 5 years before moving to the specialty of cardiology. She is celebrating her 4-year anniversary with Iredell this month. Tori loves working for a hospital that serves the community where she lives and enjoys spending time with her family on their farm, where they are always happily busy with horses, cows, and farming small grains and making hay. She also looks forward to returning to church soon. And now I'll go ahead and turn it over to Tori.
Good evening, guys, and thank you, Megan, for that lovely introduction. Obviously, tonight's talk would be a whole lot more fun in person, but we're making do and making accommodations. So we're going to discuss women and heart disease. My clicker's not working. Okay. So by the end of this talk, my goals are for everyone here to have a basic understanding of what the heart does, to recognize some common symptoms of heart disease, and to have just a general idea of when to seek medical evaluation. When should I go to my doctor? When should I go to the emergency room? And of course, learn something new. The purpose of this talk is not to diagnose or treat any patients. So what is heart disease? Heart disease encompasses many different problems involving the heart. This is only about a 20-minute talk, so we can't go into great detail, but we're just going to kind of briefly touch on some of the most common types. Coronary artery disease, heart valve disease, arrhythmias, congestive heart failure, and congenital heart disease. There are other types of heart disease that we just don't have time to get into. Some of those also include stroke and hypertension. So before we get into disease types, let's spend just a few minutes on basic anatomy of the heart, and we'll use what we learn here going forward. So the heart basically is a pump. Its job is to pump blood, okay? The heart is made up of 4 chambers. You have 2 chambers on the top and 2 chambers on the bottom. The 2 on the top are called the atrium. Left atrium on the left, right atrium on the right. The 2 chambers on the bottom are called ventricles. Left ventricles, right ventricles. And there are 4 valves within the heart. Those help push blood from one chamber to the other, and as well as help it leave the heart. We break the heart into the right side, which we commonly call the lung side of the heart, and the left side. When the left bottom chamber squeezes, it pumps oxygenated blood out into the whole body. So very, very important section of the heart. The right side of the heart has the blood that all of the oxygen has been used, and when it pumps, it gets that blood back to the lungs so it can get more oxygen in it and then go to the rest of the body. So the first topic of heart diseases that we're going to talk about is coronary artery disease. In medicine, we love 3-letter shortcuts. So we call it CAD. Most people in the community call this blockages. So the heart is a muscle, and it needs blood supplied to the muscle itself to do its function. If you look at the picture here at the top, it shows you a brief area of the three main arteries that supply blood to the heart muscle itself. You've got two arteries on the left called the circumflex and the left anterior descending artery. And then you've got one artery on the right called the right coronary artery. You can have blockages in any of those arteries, and that is considered coronary artery disease. There are certain risk factors that make you more likely to develop coronary artery disease or CAD. Some of those can be age. This is more likely to occur in older people, people with diabetes, people that smoke, high blood pressure, high cholesterol, being overweight, and those with family history of other people that have had blockages. So trying to prevent or reduce your risk of CAD is we try to modify all of those risk factors. Pretty much we can make changes to all of those except for the family history. None of us can change our genetics, so we try to change everything else. Can you lose weight? Can you get your blood sugars under better control? Can you get your blood pressure and your cholesterol better? There are two types of cholesterol. Everybody hears about the good cholesterol and the bad cholesterol. And a lot of people have a hard time remembering, is the HDL, is that the good one or the bad one? Do I want that high? Do I want that low? One of my professors in school told me that the HDL, remember the H stands for happy. So that's the good one. So you want that one high. And if you get it high enough, it actually helps protect your heart. And obviously then that leaves the LDL is the bad one. So we want that one low. One of the best ways to raise your HDL is exercise. Exercise doesn't mean necessarily a gym membership and extensive time. It's just exerting yourself to the point where you sweat. You can do that walking in your neighborhood. Let's see. If you look at the picture down here at the bottom, there is kind of a representation of what those blockages look like. The artery up at the top is completely normal. The one in the middle has a small amount of blockage, and then the one to the bottom has a significant or obstructive amount of blockage. We consider that blockages that are 70% or greater to be obstructive, and those typically get treated with things like balloons, stents that you have heard about, or sometimes bypass surgery. Any blockages that are less than that are treated with medicines such as cholesterol lowering medicines, aspirin, baby aspirin a day, and those modifications that we talked about stopping smoking, exercise, diet, such as those. Alrighty. So what are some symptoms of coronary artery disease? A lot of people come into the hospital with chest pain and trying to figure out, is this chest pain from CAD or is this chest pain from something else? Classic symptoms are those related to activity. Hey, I'm carrying groceries in the house and I'm climbing steps, or I'm rolling the trash can up the hill of my driveway and my chest feels tight, or I'm unusually short of breath. And then when I sit down and rest, those symptoms go away. So they're typically exertional driven symptoms or activity related symptoms that go away with rest. a lot of people go, well, how are symptoms like that different from a heart attack? And that takes us to our next slide. So what is a heart attack? So this picture here, again, shows the surface of the heart with an artery, and it gives you a close-up. And that artery, that blockage, is blocking that artery 100%. So it's not a small blockage that's 70, 80, 90%, it's 100% blocked. And so there is no blood that gets to that area of muscle that's past that blockage. And you can see in the picture that muscle is kind of turning a dark color. The muscle must have blood and must have oxygen for it to function. Okay. So what they had kind of wanted me to focus on were women and heart attack, women and heart disease. Some of their symptoms can differ from men, and I think that this chart does a good job. There's a lot of very classic heart attack symptoms that when mass media tries to educate the community, they talk about. Typically, the classic story is sudden onset of chest pain. Now that can be across the chest, it can be left-sided, it can be center, it can be right-sided. Sometimes that pain radiates into the shoulders, the neck, or the jaw. A lot of times is accompanied by shortness of breath, sometimes nausea with or without vomiting. And also patients often become very sweaty or gray in color, feel like they may pass out. Or they could have chest pain just by themselves or only shortness of breath, but it typically can vary from person to person. I think rather than women feeling heart attack symptoms differently than men, I think that they're more individualized. You take 10 people that have a heart attack and they're all going to feel these symptoms a little bit differently. Our bodies are all just a little bit different. But if you do have any of these signs that are all of a sudden that come on that are severe and you know something is wrong, you should not sit at home and wait and think about it. And maybe I've got a doctor's appointment in 2 days, I'll just talk to him then. It's a good idea to go ahead and call 911 and chew 4 baby aspirin. Okay. Oh, one other thing, while I was on this slide here, I did want to mention to you guys that part of my job here at Iredell is I work with our interventional cardiologist, which is a fancy word for he's our stent and balloon guy. And so he's the one that takes care of patients that come in to Iredell here with heart attacks. And I talk to patients every day that go, well, I didn't know that you treated heart attacks at Iredell. So I want to make sure that our people in our community know we do treat heart attacks here at Iredell. We've been doing stents and balloons in this for the last 11 years. So I just wanted to get that message out there. All right. Next subject, valvular heart disease. So we had mentioned back in our anatomy slide that the heart has 4 valves. Essentially, valvular heart disease means that the valve isn't functioning 100% correctly. If anybody has ever been told that they had a murmur, this stems from typically a valve that is leaking just a little bit. And it's very common to have a murmur without having a serious heart disease, especially women that have been pregnant. A lot of times they'll develop a murmur during pregnancy. Then after the delivery, that murmur goes away. Just has to do with the increased blood flow and stress on the heart with being pregnant. Typically, heart valves. So what can go wrong? Either the heart valve is stiff and doesn't normally should open like this, and then it gets real stiff and it doesn't open very well at all. So it doesn't let the blood cross, or it opens very widely and leaks big time that way. So either it's super leaky or super stiff, are the two most common areas where a valve is not working well. Most common reasons for heart valve disease are age, history of rheumatic fever, or a congenital malformation, which just means that you were born with it and you've had it your whole life. Symptoms of valvular heart disease: unusual shortness of breath with activity. It can give you chest pain. It can make you feel dizzy or pass out. May give you actually some similar symptoms that go along with congestive heart failure, which we'll talk about in a few minutes, where you can have swelling in your belly or your lower legs and your ankles, a cough when lying down, be unusually fatigued with minimal activity. Okay. Arrhythmias. So that is where the heart is out of rhythm. So before we talk about it being out of rhythm, let's talk about a normal heartbeat. If you remember back from our anatomy slide, the top of the heart is called the atrium. There's two at the top, and then the bottom of the heart is the ventricle. In a normal heartbeat, the atrium, the top of the heart, squeezes first. There's a slight delay, and then the bottom squeezes. That's a normal heartbeat. So top, slight delay, bottom, top, bottom. That's the normal heartbeat. So an arrhythmia is any type of rhythm where it doesn't beat that way. We could spend hours talking about arrhythmias instead of just briefly for a few minutes. One of the most common arrhythmias that we see in our outpatient practices, as well as here at the hospital, is atrial fibrillation and atrial flutter. That is where the top of the heart, instead of the impulse that tells this to squeeze coming from one spot, it comes from multiple spots in the top of the heart. So instead of a good dedicated squeeze, you kind of get a fluttering or a fibrillation, and then the bottom has a tendency to go very fast to try to keep up with the top. Common signs and symptoms of atrial fibrillation: a lot of patients talk about feeling that their heart is racing or jumping or flipping over. They also can have some chest pain, some shortness of breath, and also can carry some similar symptoms to that congestive heart failure that we had talked about with the valve disease, and we'll talk about in more detail in a few minutes. And those are the shortness of breath, the swelling in their belly or swelling in their lower legs. All right. This takes us to congestive heart failure. This is something that most people in the community have heard before. One thing that a lot of people aren't familiar with that I wanted to do just a few minutes on is that there are two types of heart failure. Most people are familiar with the pictures down at the bottom of the screen, the one that says systolic heart failure. This is a depiction where that bottom left chamber, the left ventricle, it is enlarged and floppy. And when the heart squeezes, it just is weak. The muscle's weak and it doesn't have a good squeeze. That is what most people think of when they think of heart failure. There is another type of heart failure, which is on the other end of the screen. It's called diastolic heart failure. Some people call this heart failure with a preserved ejection fraction. I know we're getting into medical jargon there. We won't go too far. Now that is opposite. If you look, this muscle down here around this left ventricle is very big and very thick compared to the normal heart and then the weak heart on the other end. And it gets big and stiff. And it's kind of like Arnold Schwarzenegger at the gym. You know, he pumps all those irons and he gets big and he gets thick and he gets muscular. But you know what? Those guys, they walk around like this. They don't move real good. They're not very flexible. And that's kind of what happens to the heart when the heart muscle gets real thick like that. The most common reason for that muscle to get thick like that is uncontrolled high blood pressure. If you think about it, the heart is a pump. And if your blood pressure is really, really high, that heart's got to squeeze extra hard to pump the blood out against that high pressure to get that oxygenated blood all over your body. And over time, that heart from pumping and squeezing so hard is like the guy at the gym. And that muscle gets thicker and thicker until it can't relax to fill with blood and it doesn't squeeze real good. It just gets big and stiff and doesn't work very well. So that's how that particular type of heart failure most commonly happens. The heart failure that most people are familiar with, where the heart kind of gets big and floppy and weak and doesn't squeeze well, that can happen from a bunch of different kinds of aspects. Commonly, if a patient has had a heart attack and they have suffered some damage from that heart attack, then that can make their heart muscle weak. Other things that can occur are viral illnesses. So these are patients that haven't had a heart attack, that don't have any blockages in their arteries, but for some reason they may have gotten a virus that decided to attack the muscle of their heart and it has made it weak. All right. Common signs of heart failure. So very similar to what we talked about with valvular heart disease and atrial fibrillation. So patients that have rapid weight gain, that they start feeling like they have fluid in their belly, they have swelling in their legs and ankles that doesn't go away. This is a little different. I know all of us at some point may have indulged in the Chinese food or the pizza, and the next day your hands get a little swollen, your ankles get a little puffy, but you go to bed, your legs are elevated, and when you get up in the morning, you're all back to normal. That's not heart failure. That's I ate too much salt. But this would be swelling that doesn't go away. Also common signs of heart failure is if I'm laying down in bed and I can't breathe. Why can't I breathe when I lay down? And maybe if I need to go to the recliner and start sleeping in it because I can breathe better. That's not normal. That should be evaluated by your doctor. Okay. Congenital heart disease is our next topic. It's pretty simple. It is any kind of abnormality involving typically the structure of the heart. So the four chambers itself or the four valves that's been present since you were born. Most of the people I'm assuming are listening in are adults. The more scary or serious heart defects, they're identified when you're a kid and or a baby. Typically, if it's not diagnosed until you're an adult, that would be a heart valve malformation, or you've had people talk about a hole in their heart. sometimes we see those in adults as well. A lot of times people go through life with these without much trouble. Most of the serious conditions are those diagnosed in childhood. So overall, what I want you to get out of this talk when it relates to women and heart disease. So heart disease is the #1 killer of women. Okay. Heart disease causes 1 in 3 women's death each year. But if we surveyed, only 1 in 5 women believe that heart disease is her greatest health threat. And out of 10 women, 9 of these 10 have 1 or more risk factors for developing heart disease. So it is a serious factor in all women as well as men. So one thing that I want you to make sure that you have in your minds is common symptoms to be aware of that may need for you to seek evaluation with your doctor, your cardiologist, or maybe go to the emergency room. If you have sudden onset chest pain, shortness of breath, nausea, sweating, those are signs of a heart attack. 4 baby aspirin and call 911 at the same time. Otherwise, any unusual shortness of breath, swelling, rapid weight gain, some chest discomfort that is brought on by activity but goes away with rest, those are all reasons to seek further evaluation with your own medical provider. All right.
Great. Thank you, Tori, so much. That was very, very insightful. I hope everybody got as much out of that as I did. I know it's great to, I think we can all agree, Tori did a great job at putting things on a level that's easy for us to understand. It's difficult sometimes to comprehend all of this, and it's just so very important. As a reminder, again, we will have this recorded and we'll post it on our Iredell Health System YouTube channel in the coming days. Share it with others who you think really need to know this information. The more people who know about it, the better we can be at helping to prevent all these serious heart diseases from happening. As another reminder, we do have 2 more of our Healthy Hearts series presentations left. So if you would like to register for those, please do so by going to our website at www.iredellhealth.org. That's ORG. And we will look forward to seeing you all then. Thank you again. Have a great night.